What I found was that in a seminal research by Patel et al., they showed that the ACE2 receptor is minimally expressed. Expressed means available or produced or numerically, it is numerically, there's a low number of the ACE2 receptor on in the nasopharyngeal passage, particularly in the nostrils of children and young children. And there was this clear age gradient in their study that showed that the older a person gets, the more ACE2 in this portion of the human being in their nostril, nasopharyngeal passage. So why is that important? Because normally when you get infected, when the virus first comes at you, this virus or other respiratory viruses, they land in the nostrils, in the oral cavity, etc., and the infection process begins there. So the issue is that well, if children didn't have such if children had such a low level of ACE2 receptors, that began to explain why children were not readily getting infected and beginning to sequelate a more severe disease. And it is a very credible part of the discussion because the reality about it is when you add that piece to the piece by some other researchers, Lois et al., who also showed that the upper respiratory tract of children were pre-activated or primed with innate immunity, with an immune posture that left it very nimble and proactive in terms of its response to subsequent to exposure to SARS-CoV-2. And you added that to the research by Yang et al., who found in the blood of children that they had collected before the SARS-CoV-2 pandemic emerged. They found B cell immunity that helped explain from prior coronavirus exposures. Because common colds give us protection, cross protection, cross reactivity to the SARS-CoV-2 coronavirus. So much so that Labert et al., they did a study of persons who survived from SARS-1 in 2003. And what they found is that when they looked at their blood, they looked at these people 18 years subsequent. They found that their immune system still reacted to the SARS-1, but they also found cross-reactivity to SARS-2. So it opened our eyes that these coronaviruses, when you expose prior and you develop an immune response to it, you develop a cross protection that protects you against other coronaviruses. And that also helps us understand why so many of the world's population, so many people around us have not gotten infected or gotten ill from COVID, and they will never because they are immune. And that has been the argument.
Tamara Ugolini for Rebel News, catching up with Dr. Paul Elias Alexander, who I interviewed a few weeks back, and we discussed the catastrophic harms caused by these public health measures and how we can start to backpedal out of them without sacrificing our most vulnerable and without conducting a live action experiment. Unfortunately, the interview that we're conducting today, where we talk about this experiment in the 5 to 11-year-olds, is too hot for the Ministry of Truth Division at YouTube. And so we can't publish any of this interview in its entirety here. Otherwise, we risk being deplatformed completely. If you scroll down, check out the description below, you will see a link to the full story, full interview, and I will have to catch you over on the flip side. I'll see you there.